Every single day, people with sciatica walk for their health. And every single day, that walk makes their sciatica worse. Not because walking is wrong, because they are walking wrong. My name is Dr. Michael Kent, and in 20 years of senior health practice, I have seen 7 specific walking mistakes that directly compress the sciatic nerve, inflame the surrounding tissue, and reinforce the exact pain cycle patients are trying to walk their way out of. 7 mistakes that turn one of the most beneficial activities available for sciatica recovery into one of the most consistent drivers of sciatic nerve irritation. Tonight, every mistake. Why each one damages the sciatic nerve specifically, and exactly how to walk correctly so that every step works for your recovery instead of against it. And real quick, if someone you know has been walking daily for their sciatica and still getting worse, pause right now and send this video to them. What they are about to hear will completely change how they walk. And if you are not subscribed yet, hit that subscribe button. Every week, this channel delivers practical science-backed solutions that actually produce results. Now let us get into all 7 completely. Before the mistakes, understand one critical thing about sciatica and walking that most people never consider. The sciatic nerve is not a passive structure sitting quietly in your lower back and leg. It is a dynamic biological cable that moves with every step you take. When you walk correctly, the sciatic nerve glides smoothly through its surrounding tissue, through the piriformis muscle, through the gluteal region, down the posterior thigh, accommodating the movement of your leg with each stride. When you walk incorrectly, specific mechanical forces repeatedly compress, stretch, or irritate the nerve with every single step. Multiply one wrong step by 2,000 in the average number of steps in a 30-minute walk, and you understand why incorrect walking patterns produce more sciatic nerve irritation than almost any other daily activity. In 20 years of working with senior patients, I have seen this pattern destroy recoveries that were otherwise going well. People doing everything right, the right supplements, the right stretches, the right sleep positions, but walking incorrectly and undoing every bit of that progress with every daily walk. Tonight that stops. Now let us go through every mistake, starting with the one that surprises people the most. Mistake 1, you strike the ground with your heel too hard. Watch someone with sciatica walk. Almost every time you will see the same thing. A hard heel strike, the heel hitting the ground first with significant force before the rest of the foot follows. It feels natural, it looks normal. But for the sciatic nerve, it creates a problem that compounds with every single step. Here is the mechanics. When your heel strikes the ground hard, the impact travels up through your leg in a straight line, ankle, knee, hip, and directly into the lumbar spine. Research published in the journal Gait and Posture measured the ground reaction forces from different heel strike patterns and found that a heavy heel strike produces impact forces of 1.5 to 2 times body weight traveling through the lower spine with each step. For someone weighing 170 pounds, that means 255 to 340 pounds of compressive force hitting the lumbar spine and the already irritated nerve roots with every step. Over a 30-minute walk at moderate pace, that impact repeats approximately 2,000 times. For the sciatic nerve specifically, under which emerges from the lumbar nerve roots absorbing this impact directly, the repeated mechanical shock from heavy heel striking maintains the inflammatory environment around the nerve root and prevents the healing that walking is supposed to promote. The fix: shorten your stride slightly. When stride length decreases, your foot lands closer to your center of gravity, naturally reducing heel strike force. Think of landing softly. Not tiptoeing, simply landing with more of your midfoot making contact first, rather than driving your heel into the ground. This single change reduces lumbar impact forces by 30 to 40%, meaningfully reducing mechanical stress on the sciatic nerve roots with every step. Mistake 2. Your hips are dropping with every step. In 20 years of practice, this is one of the most consistent patterns I observe in patients whose sciatica never fully responds to treatment. One hip drops noticeably lower than the other with each step. This is called a Trendelenburg gait pattern, and it is one of the most reliable drivers of ongoing sciatic nerve irritation in people who walk regularly. The gluteus medius, the muscle on the outer side of your hip, keeps your pelvis level when the opposite foot lifts from the ground. In patients with sciatica, the gluteus medius on the affected side is frequently inhibited. The pain and inflammation around the sciatic nerve suppresses the muscle's normal activation. The result is that every time the unaffected foot leaves the ground, the affected hip drops, tilting the entire pelvis and creating lateral shear force on the lumbar vertebrae and nerve roots. 2,000 repetitions of that shear per walk, every day. The fix. Consciously keep your hips level as you walk. Imagine a glass of water balanced on each hip that you cannot spill. This cue activates the gluteus medius deliberately while the inhibition pattern is being addressed. Adding side-lying hip abduction exercises, simply lying on your side and lifting the top leg 20 times, directly strengthens the gluteus medius and reduces the Trendelenburg pattern progressively over 2 to 3 weeks of consistent practice. Mistake 3, you are wearing the wrong shoes. This is the mistake patients pay the least attention to. And for sciatica specifically, it carries consequences that accumulate silently with every single walk. 2 shoe characteristics directly affect sciatic nerve irritation during walking. The first is heel height. Any shoe with a heel, even a modest 1-inch heel most people consider essentially flat, tips the pelvis into anterior tilt. Anterior pelvic tilt increases the lumbar lordotic curve. An exaggerated lumbar curve narrows the inner vertebral foramina, the spaces through which sciatic nerve roots exit the spine. Narrower foramina means more compression on the nerve root with every step. Research published in the journal Spine found that even a 1-inch heel height increased lumbar lordosis by approximately 7 degrees and significantly increased compressive loading on the L4, L5, and L5-S1 nerve roots, the most common levels of sciatic nerve origin. The second characteristic is sole rigidity. A stiff sole prevents the natural heel-to-toe rolling motion of the foot during walking. When this rolling motion is disrupted, the piriformis muscle, sitting directly over the sciatic nerve in the deep gluteal region, works harder and maintains higher tension throughout the walking cycle. Chronically elevated piriformis tension is one of the primary drivers of piriformis-mediated sciatic nerve compression. The ideal walking shoe for sciatica has a flat or near-flat sole, no more than a 1/4-inch heel differential, a flexible forefoot that bends easily at the ball of the foot. Adequate midsole cushioning without excess rigidity. Replace walking shoes every 10 to 12 months of regular use. The midsole deteriorates significantly by this point, even when the outer sole still appears intact. Mistake 4. You walk after prolonged sitting without preparation. This is one of the most damaging patterns I have observed across 20 years of senior health practice. Someone sits for 2 or 3 hours, then stands up and immediately begins their walk. They feel stiff for the first few minutes. They push through it, and by the end of the walk, their sciatica is significantly worse than before they started. Here is exactly what happens during prolonged sitting. The piriformis muscle shortens and tightens as it adapts to the seated hip position. The hip flexors shorten. The lumbar spine flexes forward, losing its natural lordotic curve. And the sciatic nerve itself, requiring movement to maintain normal gliding capacity, develops increased neural tension and reduced excursion after extended static positioning. Research published in the journal Clinical Biomechanics found that sciatic nerve excursion was significantly reduced after 30 minutes of seated positioning compared to baseline measurements after normal activity. When you stand from prolonged sitting and immediately walk at full pace, you are placing a shortened piriformis, tight hip flexors, and a nerve with reduced gliding capacity under the full mechanical demand of walking stride after stride. The fix requires 2 minutes. Before every walk following a period of sitting, perform 5 slow pelvic circles in each direction, hands on hips, slowly rotate the pelvis in a large circle. This reactivates the lumbar and hip musculature, begins restoring sciatic nerve gliding capacity, and reestablishes the natural lordotic curve before loading begins. Then begin walking at deliberately slow pace for the first 5 minutes. Your nerve needs this transition time. Mistake 5. You walk on hard pavement every single day. Most patients with sciatica walk the same route every day. Concrete sidewalks, asphalt roads, hard flat surfaces that provide zero shock absorption and force the same mechanical loading pattern on the lumbar spine and sciatic nerve with every identical step. 2 problems with exclusive hard surface walking. First, hard surfaces amplify ground reaction forces traveling up through the spine with each step. Grass, trails, and packed dirt absorb a meaningful percentage of this impact before it reaches the lumbar nerve roots. Second, completely flat uniform surfaces eliminate the proprioceptive challenge that makes walking genuinely therapeutic for nerve conditions. Walking on varied surfaces, slight inclines, gentle unevenness, different textures, activates the proprioceptive system in the feet and ankles and sends continuous sensory input through the peripheral nervous system, including the sciatic nerve branches. This sensory activation is one of the most effective natural mechanisms for reducing central sensitization, the nervous system amplification that makes sciatica so persistent. The fix: alternate your walking surface. 3 days per week, walk on grass, a dirt trail, or a rubberized track. These surfaces reduce impact forces and provide the proprioceptive variety that sciatic nerve sensory pathways need. Even walking on a slightly uneven grass lawn produces meaningfully different sensory input than flat pavement, and that difference produces measurable reductions in nerve hypersensitivity over time. Mistake 6. Your arms are not moving correctly. Patients with sciatica almost universally hold their arms stiffly at their sides or cross them over their chest while walking, unconsciously protecting the painful area by restricting upper body movement. Both patterns create a significant mechanical problem for the lumbar spine and sciatic nerve. Walking is a cross-pattern movement. Right arm and left leg move forward together. Left arm and right leg move forward together. This coordination distributes rotational forces symmetrically across the spine. The torque from the right leg swing is balanced by the left arm swing. When arms are held still or crossed, the spine absorbs all rotational forces from leg movement without counterbalancing. The resulting asymmetric rotational stress concentrates at the lumbar vertebrae, exactly where sciatic nerve roots emerge. Research from the Journal of Experimental Biology found that restricted arm swing during walking increased lumbar spine rotation by 30% compared to natural arm swing, significantly increasing mechanical stress at the nerve root level. The fix: allow arms to swing naturally, bend elbows to approximately 90 degrees, relax shoulders completely. As the left leg steps forward, allow the right arm to swing forward naturally. Stop restraining it. Within 3 to 4 days of conscious practice, the pattern normalizes and the protective bracing generating extra lumbar stress resolves. Mistake 7. You walk too long without stopping. In my practice, I consistently see patients who believe that longer walks always produce better outcomes. More steps means more benefit. Push through the pain. Keep going. For sciatica, this approach is actively counterproductive, and the reason is specific. The sciatic nerve, when inflamed and hypersensitive, has a mechanical loading tolerance. Below this threshold, walking promotes nerve gliding, reduces adhesions, improves circulation, and generates the anti-inflammatory myokine release from contracting muscles that directly benefits the nerve environment. Above this threshold, sustained mechanical loading produces progressive nerve root irritation accumulating through the walk. By the time a 45 or 60-minute walk ends, the nerve has been irritated well beyond what it can recover from before the next session. This explains why so many patients report that short walks improve their sciatica, while longer walks significantly worsen it. It is not fitness level, it is nerve loading threshold. Research on nerve tissue responses to sustained mechanical loading published in the Journal of Peripheral Nervous System Research found that prolonged loading of inflamed peripheral nerve tissue produced progressive increases in inflammatory markers beginning after approximately 20 minutes of continuous loading in inflamed nerve samples. The fix: walk 15 to 20 minutes maximum per session during active sciatica periods. Walk this shorter distance twice daily rather than once for longer. 2 15-minute walks produce better sciatic nerve outcomes than one 30-minute walk. Each shorter session stays below the nerve loading threshold while still providing cumulative mechanical and circulatory benefits. As sciatica improves and morning pain scores consistently drop below 4 out of 10, gradually extend duration, adding 5 minutes every 2 weeks. Your complete correct walking protocol. Here's exactly how every walk should look starting from your very next one. Before you walk, if you have been sitting for more than 30 minutes, perform 5 slow pelvic circles in each direction. 90 seconds, non-negotiable. First 5 minutes, walk deliberately slowly, almost leisurely. This is sciatic nerve preparation time. Piriformis releasing, hip flexors lengthening, nerve beginning to glide. Minutes 5 through 15. Comfortable conversational pace, not pushing, arms swinging naturally at 90 degrees, hips level, the glass of water cue, landing softly with midfoot contact rather than driving heel impact. Surface rotation, alternate between pavement and grass or trail across the week, never exclusively hard, flat concrete every single day. Maximum duration, 15 to 20 minutes per session during active sciatica, twice daily if possible, morning and evening. After your walk, 1 glass of water immediately. Then 2 stretches taking 3 minutes combined. First, the standing piriformis stretch. Cross the affected leg over the opposite knee and lower slowly into a slight squat for 30 seconds, repeated 3 times. Second, the standing hip flexor stretch. Step 1 foot forward into a gentle lunge position and press the back hip forward gently for 30 seconds each side. In 20 years of practice, the patients who recover most completely from sciatica are not always the ones who do the most. They are the ones who do the right things consistently. 7 mistakes corrected, 1 walk at a time. How old are you? Drop it in the comments right now along with your city. And tell me, which of these 7 mistakes are you currently making on your daily walks? In 20 years of practice, I have never stopped being slow about which patterns affect which age groups most. I read every single comment personally. Share this with someone whose daily walk is making their sciatica worse without them realizing why. Subscribe and turn on notifications because every week this channel brings you something equally specific and equally practical. Fix 1 mistake per walk. 7 walks, 7 corrections, and let every step finally work for your recovery. This video is for educational and informational purposes only. It does not constitute medical advice, diagnosis, or treatment. Dr. Michael Kent is a senior health educator with 20 years of experience in senior wellness. Always consult a qualified, licensed healthcare professional before beginning or modifying any exercise program, especially if managing serious spinal conditions, recent surgery, or cardiovascular concerns. If walking produces severe or rapidly worsening pain, stop immediately and seek medical evaluation. Nothing here intends to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.